If you don't have good health care, you're really not going to have a healthy community. So healthcare is incredibly important, and that's why I think that we've been very fortunate to have St. Pete's.
Helena's a big, small town.
We're fortunate to live in a community where people are still connected and people still care about each other. And, you know, we do work shoulder to shoulder to make this a better place.
But the people here really understand community. They understand that you have to take care of your neighbor. And that's a very, very rare thing. I've lived all over the country. I've worked all over the country. And what Helena has, what we have here in Helena, is very different and very special.
And that's part of being part of St. Peter's. In a community this size, yes, all patients are the same. We give them all our best. But there's that special connection when you're really, truly taking care of your friends and neighbors.
The folks at St. Peter's, they are the first people that touch your child when they are born. They bring them into the world, and oftentimes they are the people that help us when we leave this world and everything in between. And that's just a profound impact that they have on our community. And Helena and St. Peter's go hand in hand together, and we're successful together.
Because they, 24 hours a day, put their arms around this community, and they serve them with dignity, respect, and loving kindness.
The hospital's here to help and try and make sometimes what's a really bad situation better.
Only thing that makes a good hospital really good are the pieces that work within it, and that's the employees. And it's all employees.
The janitors, the electricians, the laundry people, everybody. Because a lot of times it is just the main people that are providing the service and all that, but there's so much more that goes on in here.
What makes this hospital run is all kinds of efforts by all kinds of people.
An organization like St. Pete's becomes great because of the people that make it that way.
It's complicated. It takes 2,000 people to make it work.
Doing the everyday thing, whether it's checking somebody in or if it's, sweeping the floor or making sure that the parking lots aren't slippery, right now in the snow or whatever.
You can tell this building is well loved, and that doesn't just happen on its own.
Security guards, the pharmacists, the secretaries, the administrators. Every job is important so that we can achieve our mission to improve the health, wellness, and quality of life of the people that we serve.
There's a lot more people than just your frontline staff that, make this hospital and any of our medical facilities work.
Everyone needs to know that they matter, because it takes the whole to create that best patient and employee experience.
For everything each and every one of them do, it doesn't matter what role somebody has.
And I think that's what true community is about, is the being there when somebody needs you so that they will be there when you need them.
I've had a horse accident. My horse slipped on the ice when we came back from riding, and I ended up going to wound care department, and Dr. Galt, his staff was outstanding. I loved every one of them. In fact, when I would walk in after the second visit, the receptionist, Anna, she would say, "Oh, hi, Delana, how are you today?" And it just made me feel so good. I felt special. I felt like I was the only one there.
I came to St. Peter's when I was in college. I ended up having to have my gallbladder removed. And before they put me under, there was this nurse, and she just put her hands on me and told me, "This is scary. I know it's scary. You've never been in this situation before, and you can feel alone, but you are not alone, and I'm not going to leave your side." And it was a moment that was really important to me for the rest of my life. I still think of her in a time where I felt vulnerable and alone. And, as a young woman, my mom wasn't here. I didn't have a sister in town. She fulfilled that for me, and she made me feel safe and secure.
I had shoulder surgery, and at 3 a.m. in the morning, I woke up in pain that was as bad, if not worse, than childbirth. So the nurse came in and took care of me and made sure that I had what was available to me for the pain. That nurse stayed with me by my side until the medicine took effect. It was just so amazing to me. I so appreciate that type of personal care. She didn't know me, but it seemed like we had known each other forever.
Last year, actually, I had to go to the emergency care room here at St. Peter's, and I couldn't believe the care that I got in the emergency room. It was just unbelievable. I mean, I got right in, they took care of it, solved the problem, and I was on my way.
These last 2 years were really tough.
Working through COVID, working through very, very difficult circumstances.
The efforts they've put in over the last couple of years, I don't think I can express in words how grateful I am to have them as part of our community and be serving us the way that they do.
And I worry about healthcare providers because oftentimes, as I said, you put the needs of your patients first over your own needs.
How they supported each other at the same time they were holding the hands of patients who were leaving this earth.
We had a lot of frontline people that didn't get to go home and spend time with their family or put their kids to bed. They had to work, and we needed them. We're short-staffed, you know. I don't really think they had much of a family life or home life. They didn't get noticed for that hard work, and they deserve every acknowledgement.
And we're thankful. We're thankful for the sacrifice. And we hope life pays you back.
To all the healthcare workers that have made sacrifices for others, whether it's in terms of working holidays, working through COVID, working through very, very difficult circumstances, that when everyone else has forgotten, when the community has moved on from COVID and they've all moved on with their lives, that when all of the other thank yous maybe have dried up or you don't hear them as much, that they would still hear mine in their ear, thanking them for the wonderful, noble, honorable work that they do.
Thank you.
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 So thank you.
You're appreciated, and we thank you very much.
And you are incredible.
You make this place special.
The personal, compassionate care provided by you.
You are a big part of making this community what it is.
Thank you so very, very much for who you are and for everything that you do.
And we're fortunate that you've chosen to do that as a profession, despite the lack of thank you.
You are so fortunate to be able to work at such a wonderful, caring place.
It was heartbreaking, but they're amazing, amazing staff that choose to do that, to come back day after day after day, because they know that they are serving our community.
Thank you. Thank you for what you do. Thank you for putting up with the bad days as well as the good days. But thank you for being there each and every day to make Helena a better community.
If you were that nurse who just put your hands on my hands and held me and said you were not going to leave my side, thank you. And, thank you from the bottom of my heart. You changed my life in a way that I don't think you probably realized. And you probably did that for hundreds of other people, thousands. And I hope you did, because that's exactly what healthcare should be.
You've made me happy in many ways, and thank you for all that you do each and every day. For those people who don't know who you are and maybe don't thank you in the way they should, I'm thanking you, and I love you for what you do.
I hope you remember who you are and why you chose to do what you do, because it makes all the difference for us. And, we're the fortunate recipients of your love and kindness. And so for all those times when you're not thanked, I hope you'll take this as my substitute thank you, because you make a difference and you're very important to all of us. And I hope you keep on doing what you're doing.